Pull yourself together.
Okay, so as a reminder, this meeting is being recorded and we may broadcast it in part or full in other venues. Actually, I think there are a couple of news outlets watching us today. So thank you so much for joining us for a session on patient empowerment with a really awesome speaker, Mindy Vincent. Mindy is a licensed clinical social worker specializing in mental health and addiction treatment, and she's the founder and executive director of the Utah Harm Reduction Coalition. So this morning when we were talking about reaching out to coalitions, this is a good one to reach out to. Mindy started the first legal syringe exchange in the state of Utah. Wow, Mindy. And has done extensive work in harm reduction, opioid overdose prevention, awareness, and treatment. And she continues to work to educate the community, stakeholders, and policymakers about harm reduction and expand services throughout the state. Mindy owns a private practice, Life Changes Counseling, in Heber City, Utah, and she received her bachelor's degree from Utah Valley University and earned her Master of Social Work and her Master of Public Administration from the University of Utah. Thank you so much, Mindy, for joining us. I'm Katie Zaman. I'm here to kind of moderate the chat and let people in, but I'm just going to hand it over to you.
Perfect. Well, thank you, Katie. It always feels so awkward, like sitting through an introduction, because I just want to So thank you so much for inviting me and letting me be here today to talk about patient empowerment. Patient empowerment is something that it's important to me from my own personal experiences, but as a clinician, I think that it's incredibly important because our job is not to walk for our clients, right? It's to walk with them until they can walk for themselves. So I wanted this to be like more of an open forum, so where we can talk about this stuff in a discussion. So, and it seems like there's a manageable number of people in here for that. So please participate in the discussion. I don't like listening to myself the whole time. So, but I wanted to start off with what does patient empowerment mean to you guys? Like to people in this room, if you had to define patient empowerment, what would it mean in your line of work and with what you do? One at a time, please. So none of you work with patients, or no?
I'll go.
Am I the only clinician here? No.
Can you hear me?
I can hear you, Deborah. Come in, Deborah.
I'll turn on my video. There we go. Hello, everybody.
Hey.
I think patient empowerment is when I let them create their treatment plan, that it's their ideas, not my plan, and giving them their voice to find out what it is that they want to do. What, why are you here? I mean, they may come in because of court, but what do you want to work on? What is that you care about most? And I, like for one of my clients said, well, I just want to stay out of jail. I'm like, okay, that's awesome. What can we do with that? What do you want to work on? And so it's their plan. And I just remember that I can have all kinds of things I could do and tell them and give them all the information, but I want them to be active and engaged. And if it's something that they come up with, then that's what empowers them. When it's their thoughts and their ideas, then they're going to want to implement that in their recovery. So that's what empowering clients is to me.
I love that, Deborah. I love that very much. What does patient empowerment mean to other friends? You all have little blacked out screens.
I think it's to add on to what Deborah was saying. I was thinking the same thing, that to have them develop their treatment plan, but coming from a strength-based perspective, finding out what their strengths are and building on those. So
I love that. One thing I think about when I think about patient empowerment is advocating, because people, oftentimes when people come into recovery from substance use disorder, which is what I specialize in, so that's typically what I'm referring to, right? They're feeling very disempowered. And we're going to actually talk about that in just a second, how people become so disempowered. But I have found that one of the coolest things that I ever get to do is to advocate for and model advocating for clients so they can learn to do it for themselves, right? And when clients get to see that someone else believes in them and will fight for them, I have seen that many times motivate people or teach people how to fight for themselves. And to me, that's one of the greatest joys ever. I love that. And it happens, I swear it happens more with people in recovery than any other group I've ever seen. Like when people recover, they go out and they do for the community, they do for others, they get involved. The vast majority, I would dare say, and that's because somebody empowered them. And then they get to use their voice and empower so many more. I remember when I first started going to like the Rally for Recovery, for instance, it was not really like that big, but now, I mean, minus COVID, that rally is bigger than any other rally I've seen up at the Capitol. It overflows the rotunda. Like you can't hear anything because everyone is going crazy, right? But those are all people who have been empowered. And they were empowered by people like me and you who get to be treatment providers. They were empowered by people, in their recovery community who taught them how to fight for themselves and stand up and advocate. And I think that that's a really great thing. Oh, Scott is saying something. Recovery is the life of sobriety engagement in life post substance advocating. Oh, it went away. Scott, feel free to just jump in and speak too, because if people type in the chat, that will distract me and I will look at the chat to see what you're saying because I care what you're saying. So if you have something to say, please jump in and share it with all of us so that we can even discuss it too. Oh, what was that? And there's so many weird sounds that come from Zoom. I'm so sorry. This is my first time presenting like through Zoom, and there is so much dinging going on that I am not sure if anyway, I'm going to try to ignore the dings. Okay. So, also, oh,
I was
yes.
just going to throw out that I think validation, and I know you said it, but that's the first thing that comes to my mind when I think of like patient empowerment is just validating, because we all have our own experiences, and to have somebody, I think that's what we all hear a lot is people discounting our experiences and what we've been through and what we think might help, or any of those things. So overall, when I think of patient empowerment, I think of validation.
I love that.
And then support and finding your path. So like validate people and then support them in getting to where they want to be.
Yeah. Which is the basis of meeting people where they're at, right? And that's what all of us should be doing, is meeting people where they're at. And really, how do you empower somebody more than by meeting them where they're at, finding out where they want to go and help them figure out how to get there. Love that. Love it. Okay. So what are some of the stigmas and biases that patients that you work with face that lead you to have to teach them empowerment? Does that make sense how I asked that question? Like, for instance, I have a list of different types of communities that I regularly, try to empower patients in. The first one being the medical community. Why would we need to empower our patients within the medical community? What if somebody in recovery has an anxiety disorder that's a significant anxiety disorder and they need to be on a benzodiazepine PRN? Should they be able to do that if they're in recovery? If they say they should, then yes, they should. And if their doctor says they should, yes, they should. But if they're in treatment or engaging in some kind of treatment, what are the chances they'll be able to get that medication? Basically zero, right? So this is just one of the many ways that I have recently been starting to advocate for patients, is that patients need access to medications that they need access to, regardless of what somebody who's not a prescriber says about that. And patients being able to stand up and say, hey, this medication is what works for me, and I need this medication. That's a big deal, because it's hard to talk to a doctor. It's hard to say to a doctor, this is what I want in my medical treatment, right? What are some other ways in the medical community that patients need to be empowered?
I think there's like almost like a divide where we feel like doctors are experts. And so we look to them for help for our health needs, but actually we know ourselves really well. And I think that's part of empowerment, is to trust ourselves and believe ourselves and communicate with our doctors.
Yeah.
Well, and I think that there's opportunity as it relates to recovery, where we are the professional, and our clients, our patients, our whomever are coming to us because their decision makers are compromised and have been compromised, and they're leaning on the professionals to help with treatment planning. So yes, there is the need to have there be voice, but there needs to be conversation rather than just, this is what I want and this is how and why I want it. The conversation of, tell me what that looks like. Tell me why and what other options have been explored. What can we do that could be an alternative? Some of the realities of very sort of tunneled thinking tend to block that from participants in their own recovery. And blanket statements, I tried that once before. I tried that 10 years ago. One of my favorite sort of treatment sayings comes from the movie Big Fish, which is an odd movie to draw from, I know. But one of the statements is, we see things differently at different times in our lives. And that's so real for anyone going through any change process, much less substance use treatment.
Yeah. How many people, and you don't have to disclose this if you don't want to, but are there people in this group who are in recovery or who are recovered from a substance use disorder? And the rest of the people have black screens, so I don't know for sure if you have your hands raised or not. So Rebecca, looks like it's just me and you. Question. Crystal, she's jumped in. All right. So question for you guys, and I can speak to this too, because it's happened to me, right? What is it like when you go to the doctor? Like when you go to a doctor and you're maybe having to get prescribed some kind of pain medication, or have you ever been mistreated in an emergency department because you had a history of addiction or mistreated by the medical community? Crystal, you're shaking your head. Yes.
Yeah. So
come off mute, friend. Join us.
I had a neck injury, and it was like, I don't know, 12, 14 years ago. I went to go to my doctor, and it was his fill-in. And he just like annihilated me. Like he wouldn't even write me a referral for physical therapy. So that through that experience, I've just developed fear. Like I don't want to go talk to a doctor. So recently I need to go back to a doctor. So I had to work with my therapist for like a month to build up the courage to go to a new doctor, to get on medication. And I was like sweating in the office, and I had all this expectation of what it was going to be like. And I walked in, and it wasn't anything like I thought it was going to be. It went really well, but just that conversation of having to say, hey, I'm a person in recovery. And now every time I go back, that conversation gets brought up. Like, how are these pills affecting your recovery? And it's, why does it have to be like that? But it has to be like that. So.
Well, I think it's a fair question to ask somebody, how is this impacting or having a negative impact on your recovery, right? I think those are fair questions to ask. However, it's been my experience and experience of many people, right, that they can't even get medications that they may need because they have a history of addiction, right? Like when I go to the doctor, I've had the same prescriber. I've been sober 14 years. So I've had the same doctor for like 10 years, which in itself is like a miracle, right? So she knows me super good. But outside of that, I don't disclose to doctors that I'm a person who's recovered from a substance use disorder because I don't like how I get treated. And that's a patient's right to not disclose that if they so choose to. But we tell people regularly within the treatment community, you have to disclose that to your doctor. And I think that for many reasons, it's good to disclose it, but I also understand why people don't want to. And really where the change needs to happen is where people are treated, so they're not afraid to disclose that. So they know they can still get the help that they need if their appendix are bursting and they've had an addiction problem in the past, right? Because I'm a recovered meth addict. I hate opiates. But do you think doctors want to prescribe any kind of opiate to me, even when it's medically necessary? Nope. And is that appropriate? No. No, it's not. And we just accept that as okay, because people who use drugs, it's internalized throughout, people that are in recovery, people who are using drugs throughout society, that people who use drugs have to be punished. They need to be punished and they need to be held accountable. They can't make decisions for themselves, which is a bunch of crap. People check themselves into detox every single day. People check themselves into treatment every single day. People are using drugs, still take care of their children. They attend work. It's the small minority of people who use drugs who are out like on the block or something, right? And so we have to be careful. Like Scott, you said something about the blanket statements, right? Like in the recovery world or in treatment, we love to make blanket statements across everybody for everyone, and then we have the audacity to say that we meet people where they're at. And that's not true. You are not meeting somebody where they're at if you're telling them what they have to do, or if you're making their treatment goals for them. I love, what was said by Deborah and by Scott about, getting the input from them. And then with our professional guidance saying, well, how do you want to achieve that? And here are some of the obstacles I see with that, like these are some of the things I've seen that haven't worked for people when they've tried to do that, or these are some of the ways that could backfire. Now you get to choose if that's what you want to do or not. And I'll be here to, either celebrate or help you pick up the pieces, right? Because that's my job. So let's go on to the treatment community. So what are ways we really need to be empowering patients in the treatment community? Do you feel like patients have power when it comes to their treatment?
As a member of the treatment community, I think that it's absolutely necessary. In the panel discussion that we had, before, I think that it's imperative that there be empowerment, because without it, the investment into what it looks like and what it is not there. It doesn't work. You're doing it for someone else when essentially you're not involved. There needs to be an interweaving of the individual within the treatment path or the direction, in order for there to be buy-in and investment in what all it takes to have successful treatment and then live in successful active recovery.
So, okay. And so I think about like patients, especially in treatment, and I've worked in the nonprofit world and I've worked in substance abuse treatment for a long time. And I think that it's been my experience. I've seen a lot that patients are disempowered in treatment. And I'm going to say things, and Veronica already knows this, so she's not going to be surprised, but I'm going to say things today that not everybody's going to agree with. And you know what? That's okay. You don't have to agree with me. You can throw whatever I say right out the window. If you're that upset about it, you can talk to your sponsor. But, I am sharing what my experience is, and I've seen people be severely disempowered in treatment. For instance, when I was in treatment, every day I woke up with this paranoid feeling that I could be kicked out of treatment and I'd lose everything that I worked for just because I wasn't changing fast enough for these other people that don't even know if I'm changing, right? I see people coming to treatment all the time that like, no, you can't take that medication here. No, you can't be on medication assisted therapy. No, we'll decide when you get to see your kid. We'll decide this, we'll decide that. And treatment overall is fairly punitive to people. And that when things are punitive, they're disempowering, right? And then we perpetuate these beliefs that people internalize, that they're powerless, that they can't make decisions. We tell them, well, I know better than you. I'm the professional here. Well, that you don't know for somebody what's best for them, right? Like Katie was saying, like each person, they really do know what's best for them. They have to find how to tap into it. And some people just haven't had the experiences they need to have to be to that place yet. And that's not good or bad. We all just have to have the experiences we have to have. So overall, I think that as treatment providers, we could do a far better job of empowering our clients instead of kind of giving them ultimatums to either do what we say or get kicked out. Because that happens every single day. And anybody who hasn't seen that, please give me a call after. I'm more than happy to share 50,000 experiences off the top of my head. So what are some other ways that that maybe the treatment or recovery community, because the treatment community and the recovery community are not the same thing. So what are some other ways that we either disempower or need to better empower people within treatment and recovery?
I think one way that we can do that is by offering services that fits around their schedule. I find a lot of times in the treatment community, we're like, well, we want you to have a job, you have to drug test, and you have to do these groups, but our groups are only during 9 to 5 when you're supposed to have a job, right? And it really sets them up to fail in a lot of ways. And we need to be more flexible as part of that treatment community in our schedules to help empower them to have a livable schedule themselves.
Oh, Matthew, I just love you. Where do you live?
I work in Millard County for Central Utah Counseling Center, and I deal primarily with drug court clients.
Oh my goodness, Matthew, I just love that because, and that's funny you'd say that, and you're a person who works with drug court clients, because I'm a graduate of felony drug court. I love drug court. Don't anybody get me wrong, but drug court's the worst at that. They're the worst. They're like, you know what? You have to have a job. And oh, by the way, when you get your new job, and you're a felon too, so, you know, good luck finding a job, especially in Millard County, right?
Yeah.
But then they're like, then you're going to need to tell your boss that you need to have every Thursday off. But eventually we'll drop that down to every third Thursday, every other Thursday. You know what I mean? And plus you also need to be offered this, this, and that. And then all the time I was told when I was in 12-step recovery that if I didn't put my recovery first, I'd have nothing else. And some people take that to such an extreme that you don't get to show up for the things in your life that are important. Like I didn't get sober. I didn't recover to not show up for the things in my life that matter. You know, recovery cannot always come first because my kids need to sometimes, my family needs to sometimes, my job needs to sometimes, you know. But when we put people in those positions and say, you have to work around this, not only is that disempowering, but they really don't have a voice, because then the alternative they often get told is, well, then you can just go to jail. How about that? You know, and it's like, is that really an alternative for somebody? Is that a good alternative? Probably not. Okay, can you guys think of some other ways? Okay. What about society? How do we help empower people in society? What are the ways people that struggle with substance use disorder are disempowered in society?
The stigma. I mean, in every single institution, there is a stigma. So housing, it's, if you have that stigma attached to you, it's hard to find housing. Employment, same thing. Education, same thing. It's a huge barrier. And then that stigma can be internalized, unfortunately, and that is horribly disempowering when you believe those things about yourself. Absolutely.
And something I just want to say really quick, bouncing back to the recovery community piece, you know, we tell people that they're powerless, and there was something you just said, Katie, and now all of a sudden it just escaped me. Do you remember what you just said? Because it will trigger what I was thinking.
Internalized stigma.
The internalized stigma. Yes. So you're also told, you know, you need to be a living amends, because I'm sorry just doesn't cut it. Has anybody else in recovery been told that? I got told that for years, that like I owed so much of a debt, and I had so much mom guilt, right? That it's like, yeah, you're right. I owe a debt to society that can never be paid. I told my federal judge that, right? And we internalize that. And you know what it does? It creates this feeling of like, you're never enough. Like you've never paid it back. You're never free from what you did way, way back then. Right. And that is disempowering, you know, to feel like I can't ask for more. Like I have a friend currently who, you know, she's got 3.5, almost 4 years sober. She gets to have her kids every other weekend. She should have 50-50 custody, but she doesn't, because people tell her, just be grateful for what you have, you know, and because society And so many other folks will say like, well, you chose drugs over your kids. And I actually don't really know many people who chose drugs over their kids. That's not an accurate thing to say. And so therefore people just feel like they are supposed to be punished. You hear it all the time when people say, I have to be accountable to this person, that person. Having all these people to be accountable to never once stopped me from using. It just created a whole group of people I had to lie to, and that's just a fact, right? And that's disempowering. And society, the language, the stigmas and the biases, right? Like when we call people junkies, when we refuse to help people unless they're being abstinent, when we think that it's okay to yell at people and to bully them into better, different behavior. Those are all things that come from society. Society says you got to punish people for using drugs, right? And that's very disempowering, and that does get internalized. I see people all the time who want to punish themselves, who believe they deserve it. And so therefore they let all those systems abuse them because they made bad choices. Has anybody else had any experiences like that? Or am I up in the night? No.
I was just thinking as you were saying,
Night too, but
can you hear me?
oh yes.
Yeah, okay. As you were talking, I was thinking, okay, so often when you get in recovery, you're labeled as not only a junkie, but a felon. Your credit is crap.
Yeah.
Sometimes you've broken like leases, right? I mean, there's just so many labels that take years to clean up, and some never.
Yeah.
And sometimes when I get around groups that nobody's ever used drugs, I mean, I work in this profession, so that I get used to that somebody has around me.
Yeah.
And I've heard people say like, I could never be friends with somebody who's used drugs or had a substance abuse problem. It's like, that's a blanket statement. That's a blanket statement. You're saying that like a blanket statement when you haven't heard the person's story. I think when you hear people's stories, then you start going, oh, they need a break or they need a leg up, But it took me years. Like I had to expunge my record to even work in this industry. You can't work with felony, which makes no sense to me. So I don't know. It's just a law. It's not even just the addict. It's a whole strew of labels that we have to contend with. So anyway, there's my 6 cents.
Yes. Yeah. And also, have you guys heard people say, those people, or they say not in my backyard, right? I had a lady actually tell me, I would tell you not just not in my backyard, not in my front yard. And I thought, well, I don't know how you thought that was gonna, but that's like the kind of biases and stigmas we face from communities, right? Like that statement was actually made during a community meeting when I was trying to open an outpatient program in a rural part of Utah. And the whole community showed up with everything but pitchforks and fire, and like shreked us out of there. That's what I call it when they do that. It's called shrekking us out of there. But that's what they said, not my backyard, not my front yard, not those people. And this is a county where more people are dying in that county per year than any other county in the state, and that's where we need to advocate and step up and say, hey, you're not going to bully these people. They need treatment. These are our community members. These are our neighbors. And because they're afraid to, especially in rural areas of Utah, like they know better. People who use drugs in rural areas of Utah know better than to speak up for themselves because the community usually isn't super supportive of them. Law enforcement definitely knows them in a small place. And these are places where we get an opportunity to step up and say, hey, these people have worth always. They have inherent worth. And these are the things we can do to help get them to a better place. Somebody did it for me. Somebody must have done it for Crystal. Somebody must have done it for the other person who's in recovery. Rebecca, you're in recovery too, right? Somebody did it for you too, right? And we get to do it for them. Ooh, it's so exciting. Gosh, I love empowerment. I love watching people turn their lives around. What about the criminal justice system? Rebecca, you were just talking about that. It's one of our most disempowering systems, but it's also the one that I would say most substance abusers enter into in one way or another. You know, that's how I got treatment. If it weren't for the criminal justice system, I couldn't have gone to treatment. But it did leave me with a scarring record, which I did just get granted a pardon a few weeks ago, a full unconditional pardon. Woo-woo. But nonetheless, that was a really long and lengthy process. If I didn't own a home, it would have kept me from housing, because you can't rent when you're a felon. If I put I'm a felon on a job application, I can't even get a job as a server. I don't even get an interview. Right? So the criminal justice system is absolutely a way that disempowers people. Are there other ways it's disempowering besides the rambling off list that I just said?
I feel like there's a lot of ways that people use substances that are legal,
Mm-hmm.
that are outside of the criminal justice system. So it kind of like, it depends on what substance you're using and how you're using it or where you're using it in some cases, that you just get labeled. And then it leaves this whole other group of people, you know, free to use behind closed doors, and not even identified as having a substance use disorder. So I think it creates these divides.
That's definitely true.
I was going to put out there that I think that you're absolutely right. I think one of the easiest ways that people know how to get treatment, or a way that they know that they can get funding for treatment, is by entering the criminal justice system. But there are ways to get treatment. There are ways to help get funding, or have at least partial funding supported without having to go through those systems. And we don't talk about that enough. We don't, I don't know if we have the resources, or if we've shared them. We need to continue to share them and talk to people about how to get things that they need without having to enter into these bigger systems that can at times create barriers that, you know, those unintended barriers or the unintentional challenges that keep following us for long periods of time.
Or how do we help them once they're already in that system, right? How do we help them to navigate it in a way that they can come out a winner, right? Because, like, for instance, when I work with the DORA officers, in Salt Lake, they have DORA officers. I don't know if they have them throughout the whole state, but it's the Drug Offender Rehabilitation Act. And I could not say enough wonderful things about DORA officers from APMP. They are the greatest POs ever. They're even better than the federal POs. They're the best. And they will work with the clients, and they'll work with the therapists, and they'll do all sorts of things to meet this client where they're at and help them stay in treatment and help them not go back to jail. And if we reformed all of APMP to be just like all the DORA officers, that would change that entire organization entirely. I can't say enough about those POs and how differently they interact and how empowering that is for the clients. You know, because I see that's like one of the only times I've ever seen my clients not be afraid of their PO. When they have a DORA officer, I've seen more clients be honest with a DORA officer than a regular PO. And that's just my experience. And it's because they know that a DORA officer is not just going to violate them and take them back. They're going to listen to treatment recommendations and work in coordination with treatment to help them stay out of jail and finish out their probation. So, Veronica, we could definitely do better at letting people know other ways that they can access funding for treatment, especially now that we have alternative funding for treatment, right? When I was going to treatment, we didn't have that. There wasn't, county funding was way smaller then. But anyway, we do need to let more people know, and then working more closely with the agencies that are involved so that we can help clients get empowered in those systems. And instead of feeling less than their PO or less than the criminal justice system, feeling like they're working together with it. You know, one of the best ways that ever happened for me when I was in drug court, my very favorite thing when I was on the good list every week was when I would draw out of the fishbowl and everybody else wanted candy bars and free UAs. And I was like, who gives a shit about a free UA? I need a standing ovation here. And like, that's my favorite thing to pull. I'd pull a standing ovation, the whole court, including my judge, stands for me and claps. And I felt so good and so like equal to and so empowered in this court, like I was doing the right things and it was being recognized. And like, it was seriously the most impactful piece of drug court for me, standing ovations. I know it sounds weird, but I like to be loved. And I felt very loved when they did that, right? What about DCFS? What can we do to better empower our clients with DCFS? I saw that face, Matthew. That's the same face that I make. What do we do? Because that's also one of our other most disempowering systems that we have, for sure, especially with substance users.
I think you brought up a point earlier that I think goes along both the criminal justice system and DCFS is I think if someone is trying, they shouldn't be punished for honesty, which I think is very unempowering to them. So if they tell their DCFS worker, look, I am struggling, that DCFS worker can take it one of two ways. Either, okay, we need to get you help, or yep, you're never seeing your kids again. And so
Yeah.
then it's this learned behavior that when I'm reaching out to get help, I get shot down every time. And
Yeah.
so I think we need to have those open dialogues and discussions about how we need to have that empathy and patience on our part to help people through these substance use disorders.
Absolutely. And I think we could also spend a lot more time in this country entirely talking about kids' rights to know their parents. Because it's just not something that we talk about here. We don't talk about the impact that separating parents from their children, even when the parents are substance users, the negative impact that has on the kids. And we co-sign on the trauma that it causes for the substance user because they deserve it, because they were using drugs. So it means they don't care about their kids. And so they deserved it, you know, and that is, I would definitely say that's the status quo currently. And I'd love to see us shift that, because people should be able, like DCFS, their mission statement is that they're supposed to keep families together, right? And so if we can do a better job helping people learn to advocate for themselves within that system, advocate for their children, their right to be parents, and, you know, recovery is not linear. It looks like this. No behavior change is linear. It all looks like this, right? But substance use is the one that we're like, no, it can't, right? And if people knew a better coping mechanism, they would use it. And we have to give people that leeway when they're trying to figure out and navigate how they're going to do this, because recovery is not an A to B thing, right? So empowering our clients within those systems and working with the people that work in those systems, because people do not go into this line of work to destroy people's lives. I do believe that people come into this line of work and eventually sometimes get burned out or get jaded. But ultimately, we all came in to do this because there was a burning in our hearts to help somebody else, right? And that's a place where we can always connect. You want to help people, I want to help people. How do we help these people together and make sure we're helping the whole group, right? Like the whole family, specifically when we're talking about DCFS, right? Can you guys think of other other parts of the community that we haven't talked about, ways that people get substance users are disempowered within communities and societies?
Mindy, I had a thought. I feel like I'm jumping in far too much, so I apologize, but
No, you're not.
I think that the theme for me is all the questions that you've asked really comes back to ensuring that we're helping advocate for the people that we're working with, helping encourage teaching them if needed. Because sometimes, I mean, I don't know, I don't remember ever being taught how to advocate for myself, but ways to effectively advocate for ourselves, because it's okay to go in and talk to a professional or to talk to a DCFS caseworker or a judge or anybody and say, I don't know what I need, but I know I don't have these things. I need help in these ways. And that can be really scary. But also, if we do have an idea or know what might be helpful, what we need, to feel confident enough to say, I'm struggling. I need help with this because I can't get this done on my own. How can I do this? Because I want to see my kids still, or I want to comply with the court orders or whatever the situation is. But again, it's that validating the advocacy and teaching how to ask the questions or share your information so that hopefully you can be heard as best as possible. Because I think that's ultimately what it boils down to, is oftentimes we just don't know how to share what we know or what we're feeling or experiencing in a way that people will hear us.
Yes, I absolutely agree. And I also think that, like you said, it is scary, especially to speak up against people that are in power and have a lot of power over you, like your freedom, your children, things like that. And so that can be really scary, but that's also where us as professionals, that's where we also get to stand next to these clients and say, you know what? I believe in you. Like, you can do this. It's okay to stand up to people in power, because once you get to be one of the people who's on the other side, right? All of us recovered people, I stand up to people in power all the time, and they don't always like it. And guess what? I don't care, because there are lots of things wrong, and it's perpetuated by people who are in power. And if people don't step up and say something, nothing's going to change. And the ways that we treat a lot of people is not acceptable. It's not acceptable. It's not okay. It has to change, even if it pisses people off. It needs to change. And we get the voices to say that, and we get to stand next to people and believe in them so they can do it too. And we have to teach them to do it in a way they're not going to get in trouble, right? Because, like, you can't just go into the judge and be like, you know what, you don't know what you're talking about, but people do know, like, hey, this type of treatment's not working for me. Like, specifically in rural areas, right? Oftentimes there's only one provider in those areas, and those clients don't get to say anything about it. It's just too bad. And that's something that needs to change. And part of it has to change in policy, because we have a Medicaid monopoly in this state. And as long as there's only one Medicaid provider in a rural area, clients are completely disempowered, and they'll do exactly what that one provider says. And it doesn't matter if they grew up with them. It doesn't matter if they know all their uncles and cousins and horses and cows. None of that matters, because they don't get to have a say. Right. So those are levels. Those are areas where we also get to make change on a policy level. I guess I should have put that, like, empowering clients. One of the greatest ways we can empower clients is by passing good policy that's based in science and research, and not off our little gut feelings, and, not based on our own personal experience in recovery, because my recovery is not your recovery and yours is not mine. Right. All right. So what are some ways that let's get into some solution here? You see the problems. We always see the problems. What are our solutions? What are the ways that we can empower people? What are your favorite ways to help somebody find empowerment in themselves? Helping people find their voice is one of my favorite things to do. There's probably nothing I love more than watching somebody stand up for themselves for the first time. I love it. Is Richfield in Millard County?
That's just on the other side of the mountain, but my company works there too. Central Utah Counseling Center.
Yeah.
Yeah. You described it perfectly. But yeah.
I've been in other rural areas of Utah that are equally as, I don't know quite the right word to use. Unfriendly, maybe, like, that are not quite as open to other ways of being or doing, right? This is the way we've always done it, so that's what we'll keep doing. And also, substance users, they don't deserve to have any say in anything, because they're junkies and they don't know how to make decisions. So, and that's a stigma we say. People say it all the time, right? They can't make decisions for themselves, so they don't get to have a say. So, but what are the ways that we empower people? How do you guys like to build people up? Let me tell you one of my favorite tricks. One of my favorite things to do with people is I have them write out goals lists, right? I make them do 30, 60, 90 days, 6 months, 1 year, 5 years, 10 years. And they have to do at least 3 under each one. And then, I make them basically make a roadmap. We build a roadmap, like they make the goal, right? And then if they struggle with the little steps as to how they achieve that goal, I help them do it, right? And oftentimes I'll have them make a vision board out of it too. Because people all the time tell me, Mindy, oh my gosh, you've accomplished so much in recovery. Look how you changed your life around. And it's like, I didn't just wake up one day and get here, like it was a long, hard fight. I could not do anything right. Like when people would say, just do the next right thing, I was like, I don't get it. And the more I try to think about the next right thing, the more likely I was to end up in left field, right? So I had to do little things, like accomplish little things. In DBT, we call it building mastery. So when you accomplish little things, you start to, before you know it, you've climbed a quarter of a way up a mountain, right? And self-esteem comes from esteemable acts. And when you have done nothing but screw up for so long, you don't believe you can do things right. You don't believe you can make changes. It's really hard to believe you can change your life around when all you've ever done is toxify everything you've ever touched, right? When you start to see those little changes that you make, you start to believe, like, hey, maybe I can. maybe I can be like some of these other people that I look up to, you know, and that's done through little steps. We can't build Rome in a day. It's one of my favorite things to tell clients too, because also people love to like, they're like, you know, I need to get my whole life back today. It's like, well, good luck with that. It took you 15 years to blow this sucker up, you know, like at least give it a year, you know. Let's see. And there was another one I was going to say, oh, and positive affirmations. So when I went through the Haven in the mornings, we have this it's morning meditation group, and everybody has to say 3 positive affirmations. And then the whole group says, yes, you are. So I'd have to say, you know, and you have to do 3 different ones every day. So I'd say, you know, I'm a good mother, I'm a good person, and I'm a good daughter. And everybody'd say, yes, you are. And it would make me almost cry, because I was like, no, I'm not. And I'm sitting here lying in front of all of you and you're encouraging it, right? But one day I said those things, and a little piece of me was like, even as I think about it, it makes me tear up, because I remember what it felt like the very first time that I felt like I had a little piece of worth. And it came from doing those positive affirmations. There was a time when I said that I was a good mom and a good person, and I was powerful or something like that. And I was like, you know what, maybe I am just a little bit, you know, and that's where that seed grew. And now today, every positive affirmation I say, I know it's true. I am spectacular, just like everybody else, you know, and I'm so grateful that I got to find out that I'm spectacular before it was too late. And everybody else deserves to find out the same thing. And positive affirmations like really works. They're strange, but true. And I also think that the best thing that we can ever do for our clients is to believe in them. And when you believe in somebody, it gives them such a strength that some of them have never had before, but some haven't had in a really long time. And in the people I work with and the place where I came from, I didn't believe in me at all. My family didn't want anything to do with me. And that's typically the case with my clients too, right? And they need us to believe in them. I hate when people say, don't work harder than the client. Well, first of all, you're the only one that's supposed to be work. You know what I mean? Like, you're doing the work. You're supposed to be helping them work, right? And we have to work harder than clients in the beginning, because they don't know what they're doing. They don't know how to get there. And some of them have such low feelings of self-worth and ability that if somebody doesn't believe in them, they're not going to make it anywhere. And it's the greatest thing we can do is to believe in another person. It's one of the reasons why I'm not a huge fan of UAs, because I find them very disempowering. And when I tell my clients, so at UHRC, you can't be kicked out of treatment for relapse. Like your substance use is not, it has no bearing on whether or not you get to continue in treatment. As long as you want to continue in treatment, we'll continue to work with you, because you came to me and asked me to help you with your substance use, right? And so then if I disengage treatment with you because you engaged in the behavior you asked me for help with, then that's not acceptable to me, right? So believing in people and setting up that space where it's like, no matter what you do, I'm willing, you know, no matter what you do in this area, right? I mean, not no matter what you do, but like, if you still struggle with your substance use, I'll still help you, because that's what you came to me for, and you will not ever be kicked out of treatment for it, right? So what I found is that my clients are honest with me about their use, because there's not a consequence coming for it. I get to talk to them and say, okay, well, what do you want to be different next time? Like, how did this happen? You know, because this was not part of the goal, right? And yeah. So does anybody have anything to say in regards to how you help empower or build someone up? Oh, I also like to drag them to like the Rally for Recovery and stuff. I make my clients go to like things like that so that they can see how we advocate, so they can see that we are in large numbers, that we are loud, and that we are not backing down.
Can you say more about what that is?
Oh, the Rally for Recovery is, well, there's recovery days too, right? So and Veronica can speak better to that stuff than I can, I bet. But well, really though, because the recovery days, doesn't DeSalma, like, don't you guys kind of put that on, or?
Sorry, had to get my mouse back over. No, we help support and ensure that recovery days can happen throughout the state. So there's like Recovery Day in September, the Rally for Recovery up at the Capitol during like legislative session. There's lots of different events like that, but anything where you're talking about getting people in the recovery community together, I think is so empowering and so just helpful. It gives that sense there is a community. There are people out here who are very supportive, who are willing to stand by you, who are willing to speak up and share their experiences too. But all of them are really great. But going up to the Capitol and actually being able to see our representatives come out and meet with folks and hear people, I think it is an incredible experience.
Yes. Oh, I love that. And Recovery Days is amazing. The Rally for Recovery is so amazing. And the Rally for Recovery is my favorite one because all the legislators are there. And we're so loud that they like stop what they're doing and come out just, because they're like, well, we seriously can't even hear in chambers, but everybody's got their signs saying, that, Odyssey saved my life. The Haven saved my life. UHRC saved my life, and there is something so empowering about standing shoulder to shoulder with 900 people who are all saying we can recover and we were worth the money you spent on our treatment and other people deserve to have access. That's what I tell my clients. They say, I went to the Haven when Dick Gillespie was around, so I steal a lot of his things that he says, but he used to always come to managers meeting. He'd be like, you know what? Somebody out there is going to die tonight that needed your bed. And I tell my clients that too. I'm like, there are truly people out there that will die tonight that needed a bed and treatment and could not get it. And it is absolutely your responsibility to ensure that people behind you get the same thing that you got. I got to go through drug court, and that's how my treatment got paid for and how I got funding. Right. So it's my obligation to fight for that program to ensure that other people in my situation get to have the same opportunities to change their life and recover that I did. Right. And every single person that gets the opportunity to recover, there's nothing so special about any of us that it got to be us that recover over anybody else. Recovery is not about who wants it. I have buried a lot of people who wanted it bad enough. That's not what it's about. Right. People have to have opportunity. And they have to have opportunity over and over again until it sticks. And every single person is worth every single episode of treatment. And it is the obligation of those of us who got those privileges to fight for them for those who come behind us, and to fight for those services to be better, and to fight for those services to be more client-centered, and for people to not get kicked out of treatment, and for people to not have children held hostage from them, and all of those things. That was my soapbox rant. That's where I hit the little gong, go ding. I get very passionate about this, because like I look back now and I see ways that, I'm grateful for everything that happened for me. And I'm grateful that I got the opportunity to recover. I'm grateful to the Haven. I'm grateful to the House of Hope. Those two programs changed my life. Right. And there's things that absolutely could have been different. I took a lot of abuse from the criminal justice system that I didn't deserve. I took abuse from treatment providers that I didn't deserve, and I don't want that to happen to other people. Just because people struggle with substance abuse does not make them liars, cheats, and thieves. Doesn't make them bad parents. None of those things are inherently true about somebody because they struggle with substance use, and we have to stop treating them like they are. And we have to stop it because it internalizes in people. It's taken me years and years and years to feel like I'm enough. 2 master's degrees later, and I'm like, should I go for a PhD? Like, when am I done with my living amends? Well, I can tell you that today I know I'm done with my living amends. I am good enough. And the people who have one day are good enough. And the people who are still using are good enough. And we all deserve the same treatment. And it's our job as providers to make sure that's happening. And it can't happen without us fighting for better policy and without us carrying it out in a meso and micro level. And fighting against powers that be that just sit and hold those positions because that's the way it's always been. We need to change a few of those things. All right, any questions, comments, concerns, queries?
Well, I just want to say that I just finished my PhD and you are way too smart. You are way too smart to do that to yourself. Do not. Don't do it.
Thank you, Katie. That's the best reason anybody ever told me to not do a PhD. I'm gonna go with that.
Yes,
What's the dissertation on?
it's on empowerment.
Oh my gosh, Katie's gonna share her dissertation with all of us.
No, nobody should have to read it.
I want to see it at least, Katie. That's only
Yeah,
fair.
send it over. It has comics.
I am so excited.
We are getting to the end of our session, and I just love your mindset, and I love your I don't know, your perspective is so like, we need to flip this over. We need to really, like, the people in recovery need to be the ones driving what's happening in policy, what's happening in the clinics, what's happening in the day-to-day. So I really appreciate you being here, Mindy. I've learned so much from you. Thank you everyone for participating. I have to read the sponsors. I'm sorry. It's brought to you today by the Utah Department of Human Services Division of Substance Abuse and Mental Health, the Rural Health Association of Utah, Utah State University, the Emma Eccles Jones College of Education and Human Services Department of Kinesiology and Health Sciences, the USU College of Humanities and Social Sciences, USU Extension, and SAMHSA.
And by viewers like you.
Yes, exactly.
I waited that whole time just to say that, Katie. I'm sorry.
Well,
And any of you who would like to reach out, I would love to network or get connected with any and all of you. I'm easily found, Mindy at utahharmreduction.org. And
yeah, check
I'm
out
easily found anyway. I'm very loud. I'm easy to find.
Yes, and definitely everyone check out the Utah Harm Reduction Coalition. It is amazing, doing amazing work. I'm so proud to know you. Thank you so much.
Katie, thank you. You're gonna make me cry. I feel the same way about you. And thank God for USU. If you guys don't know, USU really you guys do so much great work, especially in rural areas. And you guys are the only university in this state that I've heard truly talk about and address harm reduction and truly try to destigmatize addiction on a real level. And I am very grateful for your work, every one of you. Thank you.
Thank you, Mindy. Thank you so much. All right, everybody. The main session is still open. If you get lost, there's another breakout session. Tomorrow morning, we have a live episode of Debunked. So please log in right away at 9. Yes. And lots of other good stuff. So I will see you all soon.
Bye, friends. Thanks for having me.
Thank you.